Who should be tested for lead and when? Ohio law requires primary health care providers to administer blood lead tests to Medicaid children at age 1 and 2. Additionally, children must be tested if no previous test has been completed, and any of the following criteria are met. The child is on Medicaid, lives in a high-risk zip code, is prone to certain other risk factors. This training will provide information about risk factors, recommendations for screening, and medical management of lead poisoning. Why is lead testing still important in Ohio? Lead is a serious environmental public health threat to children in Ohio. How does lead affect child health and development? Blood lead levels less than 10 micrograms per deciliter are associated with increased behavioral effects, delayed puberty, and decreases in hearing, cognitive performance, and growth. Even at low blood lead levels of less than 5 micrograms per deciliter, lower IQ scores, decreased academic achievement, and increases in behavioral problems have been observed. There is no safe or normal blood lead level, other than 0. What are the sources of lead exposure? Paint, jewelry, old painted toys and furniture, folk remedies, and water can all be sources of lead exposure. Certain occupations such as construction and manufacturing, and hobbies such as hunting, furniture refinishing, and remodeling can be additional sources. Ohio law requires that physicians screen children less than 6 years of age at risk of lead poisoning. If the parents answer yes or do not know to any of the following questions, then test. It's Ohio law. 1. Does the child live in or regularly visit a property, including child care centers, preschools, or homes of babysitters or relatives, built before 1978? 2. Is the child on Medicaid? 3. Does the child live in a high-risk zip code? Visit odh.ohio.gov/provider-lead-info for the testing requirements. Questions to ask. Ask the parent questions to assess the risk of lead exposure. If the parent responds yes or do not know to any of these questions, you must perform the test. Does the child have a sibling or playmate that currently has or previously had lead poisoning? Does the child frequently come in contact with an adult who has a hobby involving lead-based materials, or who works at a job with potential lead exposure? Did the child's mother have known lead exposure during her pregnancy with the child? Does the child live near an active or former lead smelter, battery recycling plant, or other industry known to release lead? If the parents answer no to all questions, provide some prevention guidance and follow up at the next visit. Parents have a right to refuse a test on the grounds that it conflicts with their religious tenets and practices. The objection must be documented in the child's medical record. How to test a child's blood level. For an effective capillary test, the patient's finger must be clean. Avoid milking the finger. Any capillary test resulting in an elevated blood lead, EBL level, must be confirmed with a venous test. All capillary test results greater than 5 micrograms per deciliter must be confirmed by a venous draw. All blood lead test results are required by law to be reported to Ohio Department of Health, ODH, by the analyzing laboratory. The Ohio Healthy Homes and Lead Poisoning Prevention Program will respond accordingly to all blood lead levels of 5 micrograms per deciliter or greater. If a positive test result is obtained, the medical management recommendations chart must be followed for testing intervals and guidelines. Ohio's physicians are uniquely positioned to fight lead poisoning in children. By following the information in this video, Ohio's children can remain lead safe and healthy. Quick reminders. Identify who needs to be tested and when to test. If a positive test result is obtained, the medical management recommendations must be followed for testing intervals and guidelines. Thank you for watching, and if you have any questions, please visit odh.ohio.gov/provider-lead-info or call 877-LEAD-SAFE, 877-532-3723.